is Dr. Jessica Meers. I am a board certified sleep psychologist, and I specialize in the treatment of insomnia disorders, but I also treat things like anxiety and depression, which is relevant for this stress discussion. I'm going to talk today about sleep and stress. And I'm doing this because I know that many of us are feeling really overwhelmed, especially if you're like me, a mom of toddlers, trying to have a career, trying to balance family, all those things, and it can feel like things are very overwhelming, especially when you consider the political and social climate that we're living in. In fact, most of the clients that I see come in and they're overwhelmingly stressed. So I'm going to be talking a little bit about how stress directly impacts sleep. And then I'm going to give you some strategies for how to cope with that. What happens in our bodies when we are overwhelmingly stressed? It's a complicated system. The system that navigates stress in our body is called the HPA axis. This is essentially the system that drives the fight or flight response. So when our hypothalamus, just an area of our brain, gets the impression that something is going on that could be stressful, it sends messages to our pituitary gland, which then sends messages to our adrenal glands that say, hey, alert, activate the stress response system. And then those adrenal glands dump cortisol, which is a stress hormone, and adrenaline, which are activating hormones, very alerting hormones that prime our body to get ready to fight or flee. That it increases heart rate and it increases your focus, and it's very alerting so that if you need to, say, run from a bear, you can do so. And I want to mention that this system is not very good at differentiating between a threat to survival and an email from your boss. We oftentimes can get stuck in this fight or flight response where our bodies think that there's a threat to survival going on. Our body is chronically dumping cortisol and adrenaline into our systems. And the problem with this, especially when it comes to sleep, cortisol in particular is part of that 24-hour rhythm of our bodies. So it's not just about the stress response, it's an alerting response that happens when cortisol comes on. So in the morning, as we are waking up, cortisol takes a sharp increase because it helps our bodies wake up and be prepared to function during the day. But when we are chronically in this fight or flight space, cortisol is dumping into our body at much higher levels and at times of the day when we don't really want cortisol in our bodies, for instance, at night. So we want cortisol during the day, and then we want cortisol to dip at night so that we can get some sleep. The problem is cortisol also suppresses a hormone called melatonin. Melatonin signals to our bodies that it's time for sleep. We might feel extra alert and may not feel ready for bed if we are feeling very activated by stress. So we want to make sure that we are controlling chronic stress to the best of our ability so that we are not stuck in overdrive. We don't want to be stuck in what we call hyperarousal when we're trying to sleep. What do we do about this? Relaxation exercises like deep breathing or progressive muscle relaxation. These are probably things you've heard of before, and they're great. But I want to go a little bit deeper with some strategies. So I have to pause and say, if your life is set up in a way that is chronically stressful and you have a lot of things to do on a daily basis, the to-do list is so long. To that stress that's going on in our world, in our country, and feeling like we could be powerless, all of this kind of compound chronic stress. But we need to make sure that we focus on reducing overwhelm, burnout, as much as we are capable of doing. So if your life is such that you are imbalanced when it comes to work and life and caretaking and all of those things, if you don't have a way to take a breath, if you don't have help, a few relaxation strategies aren't going to be like the thing that does it for you. So we first need to look at the systems of our lives. How can we ask for help when we need it? How can we give ourselves time and space to breathe? How can we focus on ourselves a little bit? Deactivate some of that overachiever mentality that keeps us in a high level of stress. Notice the systems in your life. And if there's no way to do everything on your to-do list every single day, then we need to change the structure of our day. If work is really overwhelming, then we need to find ways to get out of whatever system that's in. Sometimes we don't have control over these systems in our lives, and therefore we just do the best we can. But we need to focus and realize where we have control over the systems of our lives and where we can find balance, and take that and face that head on. Do the things that are going to be good for you, because that's going to reduce that stress response. One thing I recommend to most people who come into my office really worried and stressed is to schedule time in your day. We call it scheduled worry time. So schedule time in your day to focus on your worries. I like to say, ask yourself the question, what is likely to keep me up tonight? And then use that time to problem solve the things that you can control. So decide what's within your ability to control and figure out a plan for addressing those things. Figure out what's outside of your control and then work on acceptance of those things and then put it away. So 20, 30 minutes. I like to do it early in the evening, not anywhere close to bedtime. We want to get this off our mind before bed so that we can give ourselves the chance to tone down the arousal at night before bed. Additionally, we need to think about something we call cognitive restructuring, which is identifying specific worrisome or stressful thoughts and then challenging them. So identify the evidence we have for those thoughts and maybe ways that we are overestimating the negative consequences of whatever. So asking yourself the evidence you have for those thoughts and work on identifying more neutral thoughts. You don't have to turn it into a positive thought. Take the approach of what's more likely to happen rather than the worst case scenario. And then lastly, never spend time in bed stressing. If you're noticing that you're feeling really activated at night when you're trying to sleep, get out of bed and go do something else that is relaxing. Get your mind off of it. The middle of the night is not the time to solve our problems, and we definitely don't need to do it while we are in bed because then we associate the bed as a place of stress and alertness, and that makes insomnia so much worse. So let me know what questions you have about stress and sleep. I'm happy to answer them in the comments. See you next time.